It's 1:01, so we'll open this meeting today, Thursday, May 1st, 2025. We're here to have a discussion on employee benefits support with Richard Broadus from the Partners Group, and I will turn it over to you to share with us what you want.
Great. Thank you, sir. Richard Broadus of the Partners Group again. Format of today's meeting is really just to get to know you all, the situation that the county is in with employee benefits, and understand where I might be able to be a resource to you all. So hopefully this meeting is a bit more conversational than it is just me presenting to you all, because you all know your benefits plan much better than I do. I took some time and reviewed the YouTube videos that have been online for back to, I think it was, back to February of 2024. So I have an idea of the conversations you've had with your current broker and what some of the outcomes of your renewals have been over the last couple of years. So just to kind of kick off the conversation, we can look at this first page of the report here, and it's really just talking about me, my personal background, and then my professional background as well. So I want to say thank you for meeting with me. It's a pretty awesome opportunity for me to be in front of you all. I, to a certain degree, feel like I grew up in the courthouse. My mom has been an employee here for 28 years, worked in all different departments. My stepdad, Mike, I call him my dad, was county sheriff for a while, as you all know. After he passed, we started the Mike Anderson Memorial Fund, so I've had the opportunity to meet with a lot of law enforcement agencies here locally to see how we might be able to benefit them as well. Went to Kellogg High School, went to the University of Idaho, actually had an internship at the prosecutor's office when I was in college. So it very much feels like I'm back home when I'm in this building. So just wanted to say thank you. And I really feel like I understand your county and your county employees a little bit better than a lot of people might have the ability to, because my mom has been an employee for so long. So that's me on a personal basis. But on a professional background, I've worked in employee benefits for a little over 10 years now. I lived in Seattle for the majority of those 10 years and worked with large national insurance brokerage firms, advising on companies from about 50 employees to 5,000 employees. So I have a background in analytics, account management, and consulting. I recently joined the Partners Group, moved back to Idaho, so I'm located in Boise. And with my move back to the state, my big goal is to take that experience that I learned in a large market like Seattle and bring it back home to benefit some of the smaller agencies and smaller companies here, especially in the Silver Valley. So that's why I'm reaching out to you and trying to understand how your relationship is going with your current broker. So I know Tracy Yost was the broker for the county for many years when he was with Advanced Benefits. He recently retired about a year and a half ago, I believe. And it seems like you've had a couple of people from Advanced Benefits kind of take over the advising on the county's plans from there. From the YouTube videos, it looks like it's Mark Fisher and what's the other one's name? James Pinkerson, I believe. So I'm just kind of curious, how has that transition been going for you all since Tracy's retirement and Mark and James taking over the account?
Well, we've probably only had 2 meetings with them.
Yeah.
Brief and to the point. So, I really couldn't say that I've gotten to know them that well yet.
Okay.
But everything has been fine as far as service goes.
Okay.
Don't know them as well as I knew Tracy.
Yeah, so. Certainly. Well, it seems like the last time that they were out here was maybe in July. Is that right? Have you seen them since then?
I couldn't tell you. I have trouble remembering what I did last week. So.
Well, at least from reviewing the YouTube videos, it looks like the last time they were out here was in July when they were handing out your renewal. And I'm just kind of curious, is that the type of support that you're looking for? Do you want, are you looking for a broker that's in here maybe only once to twice a year? Or would you like somebody that's partnering with you all a little bit more to understand your employees and how you're offering benefits maybe in here 5 times a year?
Well, I don't want to do all the talking, so jump in.
Well, I'm so new.
Yes,
so
you haven't even met with them yet.
Yeah.
So I think we don't know what the options are. With Tracy, we probably did see him a little bit more.
Yeah.
So I don't know that we know what the best plan would be. I guess that's why I was interested in being here today, to hear how you support your clients.
Certainly. Yeah. So typically what I'm doing with my clients is I'm meeting with them 4 to 6 times a year. So usually you guys renew October 1st. The way that I would operate, if we renew it on October 1st, I would be back in here in December or January discussing with you, how did everything go? how was open enrollment? How did starting the new contracts go? We moved insurance carriers. How did that all play out? And then I'd be in here again in March, May time to start having conversations about what does a renewal look like this year. So I know you all are with the GEM plan. I actually reached out to the GEM plan before this meeting to get an idea of how their renewals are looking this year. It sounds like it's been a really good partnership for you all, being in single digit increases since you joined them. They kind of tout that they've had single digit increases for counties for the last 14 years. And it sounds like they're on track for another single digit increase. I know that's a vehicle that Tracy got you all into prior to his retirement, and it seems like it's been a really great plan option for you.
Better would be a zero increase, but
certainly,
yeah.
Certainly. Unfortunately, increases are pretty standard across the board now. I mean, if you're looking at medical trend, it's around 10% in the United States. If you're looking at pharmaceutical trend, it's closer to 13 to 15. So I know you got about a 5.9% increase last year. So beating trend by a good 4+% is a pretty decent renewal. So that's around 6 months out. I'd be meeting with you all again to talk about our strategic plan. What are our initiatives for this year? I know you as a recently elected commissioner, and Dave, I know you've been around for a little bit longer, but you all have initiatives that you're trying to solve for, right? So I view myself with my clients as a partner that helps you get to where you want to be. I'm here to align your benefit structure to your organization's goals. And there's no other way to do that without having strategic conversations about what are your goals, right? So that's what that second meeting would look like. And then around the time of renewal, you renew in October, your renewal probably releases in June to July, somewhere in that area. We'd be meeting with you as soon as we got that renewal, having a conversation. How does it feel? Do we want to go to market? Let's check other insurance companies to see what type of options are available to you. Talking about the latest and greatest in the market when it comes to employee benefits. There's products coming out all the time that can be really beneficial for employees. I know something that you all had talked about before was maybe a wellness plan or a well-being program, incentivizing employees to take part in certain things like step challenges to contain their health a little bit better and drive cost savings, right? Seems like in the past, the idea was that might be a little bit difficult to implement, might be a little costly to implement. That is one really big thing that's a differentiator for me and my firm is we have a team that is solely involved in well-being. And the head of that team is actually a licensed therapist herself, and she does so much more than just wellness. And she is really great about doing surveys with employees, understanding what employees are looking for. And those are some of the things that we'd start to talk about in those strategic meetings around the time where you're getting your renewal. After we do that marketing, we come back in again, sit down, hear all the options that are available to you in the marketplace. These are all the different things that we talked about, and here's how we followed through with all of them. I think that's another thing that I noticed when watching those YouTube videos was the current broker had talked about doing some marketing of your plan, and then when it came to renewal time, they just walked in and said, here's your renewal. And I mean, there might have been conversations that I wasn't privy to being outside of the YouTube videos where maybe there was a change in that direction, but I'm a firm believer that if you say you're going to do something, you follow through. And even if it takes a little bit more time, a little bit more work, a 5.9% increase, like I said, is a pretty decent increase, but you never know what's out there unless you check, right? So after we make those renewal decisions, then we roll into open enrollment. And we would sit with you on all those implementation meetings with carriers to get your systems going. I believe you're using Employee Navigator right now. Is that right? You guys know?
I couldn't tell you that.
Yeah.
No,
Okay.
that's
Online
not
enrollment
our
system.
department.
Okay. So we would work in conjunction with you to help get that set up and get those new plans active. And then we would host open enrollment meetings ourselves. I believe you guys typically do a wellness fair in October, November. Is that right?
Does anybody remember when? Or did we even pull off the last one? We did, didn't we?
I don't remember if we did last year.
Yeah, the year before, but I can't remember last year.
It seemed like it might not have happened last year. I wasn't completely sure.
We haven't had tremendous interest in
Okay.
county employees with that.
Yeah, and it sounded like it might be a timing thing as well, doing it in November, October compared to there was some discussion about moving it earlier in the year from the YouTube videos that I saw. And another thing was your broker had talked to you about bringing in carrier resources and having Delta Dental that you're with come in and provide, either some goodie bags, things of that nature, or also doing a lot of times carriers will come in with like a $25 gift certificate or a $100 gift certificate for people that are participating in those kind of wellness fairs, right? And it's a really great driver to get people there. And I'm not sure if that was completely followed through with or not either. So that's another area where we would be supporting you is open enrollment meetings. I would be here myself talking with all of the employees about their options, here to support you every step of the way. I would also have an account manager with me that would be here supporting you as well. They're your day-to-day contact, but as you know, you have a direct line to me. I know my cell phone number is in my signature. You can always call my mom and she can track me down anywhere that I'm at. And then we get you to that point of renewal. And then once again, we're back into that how did everything go conversation. So again, just illustrating that I'm meeting with my clients more like 4 to 6 times a year and really aligning our strategy with the organizational goals.
And where would the account manager be based?
The account manager would most likely be based out of Boise.
Out of Boise?
Out of Boise. We also have offices in Portland, Bend, Seattle, and Phoenix. And, you know, having close ties to the community through the Mike Gunderson Memorial Fund, my family being up here, I'm in the area once every 2 months.
Okay.
So that's usually you would see me popping in, just saying hi, checking on how things are going. I'm up in the courthouse every single time I'm here anyways. I just was in the prosecutor's office talking to Ben, and my next goal is to track Keisha down to say hi. But very, very familiar with the courthouse and always here when I'm in town. So even though I am in Boise, like I said, I'm in the area a lot, and I'm always in the building.
Okay.
So that's kind of the strategic approach that I take with my clients. I'm curious to know, as you know, newly elected commissioner and one that's been around for a little while, what are the big initiatives that the commissioners are trying to solve for in your current terms? Do you have any goals that you're trying to get to? It sounds like cost might be a big driver for you all, but talk to me a little bit about your goals and your initiatives.
Well, you just hit the big one.
Yeah.
Cost. Every time we turn around, we're seeing a cut. SRS funds, you know, just one thing after another. So cost has probably been the biggest motivating, you know, the biggest piece moving things around. So our goal would be to get the most we can for the money we have, because the money we have is shrinking.
Certainly.
And so that's why I'm curious to see what all, you know, your perspective on that.
Yeah. Great. Well, when it comes to cost being involved in saving with your employee benefits plan, right? There's a couple of different ways that you can do that, and that's adjusting benefits, and then there's asking for employees to contribute more to their plans, right? I'm not completely familiar with what type of plan offerings you guys have right now. Can you tell me what types of plans, especially on the medical side, you're providing to your employees? Are they PPOs, high deductible health plans? I think you might have a PPO with an HRA paired with it.
And I don't get the benefits, so
And I don't use them as much, so I don't know that I could tell you with all those fancy letters which ones we have.
Certainly.
Sydney, do you have any idea?
The PPO with HRA sounds familiar.
Okay.
Yeah.
So PPO plan is really a plan that's set up with a deductible and out-of-pocket maximum, and most of your hospital services and doctor services are covered at a copay basis. So you're paying an upfront dollar amount, and then you're usually not having to take care of too much more after that. So that's what we call a traditional PPO, preferred provider organization, is what PPO stands for.
I believe that's where we are right now.
And pairing it with an HRA is a really good vehicle to drive some cost savings. The reason for that is what the employees don't use out of that HRA account comes back to the county at the end of the year. It doesn't roll over. There are some other plan designs, like high deductible health plans, that typically have higher deductibles, and they're also known as consumer-driven health plans. And the reason for that is employees have to pay a portion on a percentage basis of just about every service that they get. And they have to meet that deductible out of their own pocket before the plan starts to pay anything. So that can be a really good option for people who maybe don't utilize their health care as much. And you can pair it with an HSA account that you as an employer can contribute to, but you do not have to. And that's a pre-tax account that employees can contribute to. So I can speak for myself, as you know, a younger male, I don't really utilize healthcare. So what I've always done in my personal life is elected a high deductible health plan with an HSA account. And what I've done is, say my high deductible health plan has a $5,000 deductible. I will fund my HSA account, maybe not $5,000 in 1 year, but I'll do $1,000 in 1 year, $2,000 in 1 year. And I've consistently rolled that account over. So now that I can cover my entire deductible, if I am to break my leg, if I'm out hunting or doing something like that, where I can have that coverage level and be satisfied and confident that I'm not going to have a really large out-of-pocket expense because I've preloaded pre-tax dollars into that account. And as I mentioned, it can be a really good cost-saving vehicle for the employer because you're asking employees to take on a larger portion of those claims because they're paying a percentage even after they hit that deductible, but they have to hit that deductible first before the plan pays anything. So there are some creative plan designs that you can certainly look at. And some potential ways to maybe tweak your offering to drive down some costs. And I think particularly for a municipality like yourself, where you need to be good stewards of the tax dollars that you're utilizing to build the funds, you should be doing marketing of your plans just about every single year, every other year at the very least, right? I also always encourage employers that they should be looking at a different broker every 5 years to make sure that their fees are staying competitive as well. I know that the county was with Tracy for years, rolled over to Advanced Benefits. I'm not sure if you all are aware, but Advanced Benefits was actually acquired by a large national insurance brokerage firm called Alliant. So Alliant is primarily private equity owned, and that's who they answer to. It's a private equity firm that owns them. What private equity typically does is really cuts down on margins, right? They run super tight, which may be a reason that you haven't seen Advanced Benefits since July of last year. If they can limit their time that they're in your doors, then they're driving more cost savings for their company and that private equity company that owns them, right? And I believe Advanced Benefits was acquired by Alliant about 2 years ago, right around the time that Tracy retired. And I actually worked for that company for a short time, so I understand how their model can work, especially for employers like yourself, wherein in benefits, municipalities, you're not making a ton of money off of because you shouldn't at the end of the day, right? So that's one thing that really differentiates my firm from the firm that you're currently working with.
Who owns TPG?
So TPG is primarily employee owned. We have a 30% private equity stake. The only reason that we took private equity stake is because in the landscape of employee benefits brokers in general, there is a large move of M&A activity primarily with private equity ownership. So our founders decided we don't want to answer to private equity. We're going to give them a small share, 30%, so that way we have funds to expand and stay competitive in the market. But then what we did is we formed other partnerships. So we have a partnership called C2 Solutions that partners with regional brokers all around the United States. So we have partners that are located in the East, the Southwest, central part of the United States that we bundle together a lot of our services and throw our weight around similar to how a national brokerage firm does. The other 70% is employee owned. So our people like to do a great job because as we grow and we get better, it benefits them by being employee owners, right? So that's a couple of the other things that I have illustrated here in this presentation for you, is really talking about who we are. We're about 270 total employees. We're in 6 different locations. We really like to tout that there is a one partner advantage, is what we call it. And with that, there are so many other services that we have underneath one roof. And that's this slide here. And that's really talking about, we're not just an employee benefits broker. We also do well-being consulting, like I was talking about. We have this really unique arm called Total Absent Management, or TAM as we refer to it. So a lot of states in the United States are implementing paid family and medical leave, things of that nature. We help our companies navigate some of those. I know that Idaho is not one of those states currently, but you do have to provide leave to your employees. So we can always consult on those contracts, what your leave policy is. We can review them and let you know how they align with other states and other counties that you might be competing with for talent. So that's another question that I just have in general for you all, is how do you utilize your employee benefits package to attract and retain employees? And who are you competing against for employees? feel like in the valley here, you have a couple of large employers, right? And I'm sure the county is one of those larger employers, so I'm sure you're competing with them as well.
Honestly, for our type of jobs, we compete a lot with Kootenai, where they pay considerably more per hour. I don't know how their benefits stack up against ours, but their pay rates. So I don't hear as much competition locally, but there is some, depending on the jobs we're hiring. But when it comes to law enforcement and specialized jobs like prosecutor's office and that, we're competing a lot with Kootenai County.
Yeah, that makes sense. Yeah, and I know that I've had a few of those conversations with the sheriff's office as well. Through the memorial fund that I'm involved in, we're looking at giving some funds to the county, and I had a meeting with them 2 months ago, just really discussing, what are your pain points? How are you keeping people here? When my dad was sheriff, it was always jailers, right? It was always hard to keep them employed.
Still.
Yep. So I understand that being in the valley here, you're a little bit unique, especially when you're competing against Kootenai County right next door that has one of the larger cities in the state, right? But that's really good to know. So just kind of continuing on about my firm, as I mentioned, C2 Solutions, we partner with a lot of other regional brokers. We're also a part of Assurance Global, which is the largest insurance association of brokers in the world. So we have a lot of resources that we can pull in and a lot of expertise. As I mentioned, we're headquartered out of Portland, but we work with counties in Oregon and in Washington as well. So municipalities and counties, I've worked on a couple of them in my career. When I was young in my career, the brokerage firm that I was at the time acquired Wells Fargo's brokerage book out of Boise, and they were actually working with Bonner County. So I had a little bit of crossover that I got to work with the county from back home a little bit, which I loved. I was kind of earmarked as the Idaho guy, so I worked on a lot of the Idaho accounts that we took over in that acquisition. Also worked with there's another county out of Oregon that I worked with when I was at that same company as well. So I'm familiar with the unique challenges that you face as municipalities, and that there are also, compliance pieces that you don't have to comply with. Big part of that is like ACA, HIPAA, ERISA, all of those, 4 to 5 letter acronyms that cause a lot of headaches for a lot of employers. You guys as counties, some of those you don't have to comply with, right? But we always have that lens that we're still looking through, because some of those federal regulations are really good to comply with, even if you don't have to. Something like having a summary plan description or an SPD around your self-funded health plan. Do you guys know if you have an SPD in place?
Not that I'm aware of, but I'm not familiar with all your acronyms.
Yeah, that's why I'll try and spell them out for you a little bit more. So an SPD, or a summary plan description, is basically a big document that talks about eligibility for your medical plan, what benefits are covered, all of these different things that are federally required to be included in a document that's handed out to employees on an annual basis. You as a county actually don't have to have an SPD, though. We as a firm do kind of suggest to have one as a best practice, just in case you ever, might need one. So it's some of those actions are good to take, even if they're not required, right? And a lot of those things are kind of under our standard scope of services as a brokerage firm. A little bit more here is just, the Partners Group. We love to tout that we are the largest privately held independent brokerage firm in the Northwest. We started in Portland. We have a lot of deep roots in Portland, but we've begun to expand out, and we have a great team in Boise as well. So we just acquired a company called Post Insurance that's been in Boise for 30 plus years. That's where I sit, is with that Post Insurance team. So we have about 40 employees in that Boise office after all is said and done. We're an employer that people love to work for, and when people are happy at their jobs, they typically do a better job at their job, right? And again, employee owned, so it drives a lot of that success as well. Mm-hmm. You have some skin in the game is a big one. And then there's this section talking about our services, and I can just run through these really quickly that might be beneficial for the county. So we have employee benefits. Myself, we have employer services, talking about retention, total asset management, well-being solutions. We have a healthcare analytics team I'm curious, do you guys get utilization data from Advanced Benefits on a reoccurring basis?
I think they've provided that during their meetings.
Okay.
But I don't know that I've gotten anything in between meetings.
Nothing outside of that. Interesting.
I'm not positive about that.
Yeah.
But
That's what it seemed like to me when I was watching some of those YouTube videos is, oh, here's your insurance or here's your utilization for the last 7-8 months. And that's, again, not how my brokerage firm works. We're typically sending out utilization data quarterly, if not monthly. I'm sitting down reviewing it with you quarterly. We're typically sending it out monthly. And the reason that you do that is so you have an idea of what's going on in your employee population when it comes to healthcare. So that way you can be proactive, right? If you see somebody pop onto a large claimant report that has a diagnosis like, really high cost diabetes medication and they're new, maybe there's something that we can do to support that employee to drive down costs and also benefit them in their own life and drive an outcome that helps them stay at work longer and actually be able to contribute to the organization longer and in a better way, right? So being as transparent as possible with that utilization data, which is yours as an organization, you own that. So that data should not be gatekept from you because it can be really informative and really actionable as well. And that's another great advantage of our healthcare analytics team is we have automatic feeds that are set up with carriers that all that data populates into, and we can do benchmarking. So when you guys are talking about changing your benefits, are you reviewing benchmarking reports? Does your current broker help you with employee surveys? How are you making those decisions to change your medical plans outside of just looking at the bottom line cost? Have you all reviewed benchmarking in the past?
yes,
You have?
Tracy did
Good.
did that with us. Like I said, I've only had 2 meetings with the new firm, so I think we got a little of that at the first or second meeting. But I have no idea what the normal amount of benchmarking is.
Yeah.
So
Typically once a year is about all you really need to benchmark, and it's around that strategy time.
okay.
What about employee surveys? Have you guys conducted any surveys of your employees to
Let's
identify
ask an
any
employee.
gaps?
Have you seen any surveys?
Yeah. So how are you getting feedback from employees on the benefits package, how they feel about it? Is it just people walk in, they shoot you an email? How are you connecting with them?
A lot of one-on-one.
Yeah.
That's one thing about this particular job. We get a lot of feedback.
Yeah. Yeah.
We get a lot of
And
feedback.
I'm sure that takes a lot of your
but I
time.
don't know that we've had a formal way of getting feedback.
Yeah. And I'm sure that takes a lot of your time having sit-down meetings one-on-one basis with the 125-ish employees that you guys have, right? So that could be a really positive thing for you all is doing an employee survey where you're actually asking for feedback instead of somebody gets to the point that they're irritated and now they're in your office taking your time and they're in a very different mindset when they've experienced something that's frustrated them compared to when you're proactively reaching out to them asking, how are your benefits working for you? And oftentimes employees can be the ones that identify gaps in coverages better than anybody else can because they're the ones utilizing it, right?
Mm-hmm.
So partnering with your employees and understanding how it is that they feel and they're utilizing your benefits can be really beneficial for multiple reasons, saving your time and creatively and taking that employee feedback and making actionable changes based off of it, right? Where you can show your employees, hey, we're listening to you and we're making the changes that you're wanting. And then I wanted to talk a little bit about wellness fairs as well. It sounds like that's something that you all have done. Have they been successful? Are you still planning on doing one this year?
Well, we probably should have had our lady who handles HR in here because she handles all of that, and she is the primary organizer of that.
Okay.
I think I'm recalling that last year it didn't happen for some reason.
Okay.
And part of that, I believe, was a lack of interest by employees or a lack of incentivization or could be timing.
Yeah. That makes sense. Okay. Is that something that you all would like to see back? Sydney, as an employee, would you like to have a wellness fair or some type of activity like that?
I've only been here a couple of years, so I had the one time, and I liked going up there.
Yeah.
So yeah, I would probably go again if
Okay.
it's fun. good advertisement.
Yeah.
Stuff like that.
Have you guys gotten any feedback from employees that they would like to see that back at all? No
I
one's-
haven't had any either way.
Okay, well that's interesting, right? That's something that you can consider doing or continue to not do. I think what I saw in some of those YouTube videos is doing some blood draws, biometric screenings, things like that have been done at those wellness fairs in the past that can be really beneficial to give good information about making informed decisions again. So what are the pain points that you guys are having right now around your benefits? Is there any noise that's going on?
As far as the benefits we have and
Current benefits. Any employees reaching out about any particular issues currently?
I haven't heard from
No,
anybody.
I haven't.
No.
No.
No, I think more the pain is more in the how we're going to fund these continuing annual increases.
Yeah.
To be honest, that's probably the more challenging part right now.
Yeah.
Everybody here that I've talked to seems to be happy to have the benefits they have.
Mm-hmm.
They are better benefits than a lot of places in this area. But how we continue to fund these increases is the pain point for me. And we're also in a position where we can't give raises much. So if we raise the cost of your insurance for the average employee, that's a pay cut.
Mm-hmm.
At a time when we're already one of the lower paid counties
Yeah.
in the state. So
Yeah.
it's a challenge.
Yeah. So it sounds like cost is the big pain point and challenge for you guys right now.
Probably from this office,
Yeah.
because we
Yes.
have to deal with the budget.
Yeah.
Exactly. Do you know, speaking of cost, how much you're paying your current broker? Do you know how they get paid?
I don't know how much we pay our current broker off the top of my head.
Yeah.
I mean, that's something back when Tracy was presenting that I was more familiar with. But,
Yeah.
but no, I don't.
And that's, I will be honest, that is one thing a lot of brokers have hidden behind in the past. There are federal regulations now where you have to be transparent about your fees. So hopefully they've provided you in the last year or so a document that really outlines all of their fees for each line of coverage. So medical, dental, vision, there's typically percentages of premiums that brokers are making off of that. And the tough thing with that is as you get increases, your broker makes more money, which really seems contradictory, doesn't it? So
It does predict a bit of a conflict.
it certainly does, right? So if I walk into your door and say, hey, you got a 10% increase, we didn't do any marketing, we just recommend this is the best. And at the end of the day, I get a 10% raise, doesn't really make much sense, does it? So I bring that up because a lot of brokers can be not fully transparent when it comes to that, and I like to address that right out of the gate. With my clients, typically what I'm doing is a flat fee service. So we pull that commission out of your premiums, and you pay me a flat $30,000, $40,000, $50,000 a year for all of my advising services and all the other services that we give. So we're really transparent when it comes to our fees. When it comes to your other benefits that you're offering outside of medical, I know you have a self-insured dental plan with Delta Dental of Idaho. What do you do for vision, life, and short-term and long-term disability? Do you have voluntary benefits that you're offering, like Aflac?
Mm-hmm.
Do you guys have any of those other
there's
products?
Aflac, too.
Okay.
Yeah.
And what about the life and disability? Are you offering those to your employees?
Life,
Life insurance?
again, we should have invited the HR person.
Yes.
Yeah.
Yeah.
I'm familiar. I know we have life.
Okay.
I have that. I'm not familiar with any disability insurance, but I could be wrong.
Mm-hmm.
But I mean, if you have questions that you need answers to move forward with some of this, then we need to hook you up with the
Yeah.
HR
Yeah.
person who manages all this.
Yeah.
Because we don't manage it.
Yeah, that completely makes sense.
Mhm.
I'm really just trying to get an idea of what you're doing holistically, and something I can talk to my mom and get your guys' benefit package from her and kind of go from there as well.
Yeah.
But I like to maybe ask those questions and understand what your direction is. Do you want to offer disability insurance? Say it's something that you're not offering currently, and you could all offer a voluntary plan where the employee takes it on. Is that something you might be interested in offering to your employees?
Just speaking for myself, if we added anything right now, it would have to be on a basis of the employee taking it on, I
That
think.
makes sense.
I don't know that we've got to find the money to cover the increase in what we already have. I don't think we're in a position to add much more.
Okay.
But yeah, giving people the option, which is
Mhm.
what we do on some of our life insurance. Like
Yeah.
I pay for a little extra.
Mm-hmm. Yeah.
So,
And that can always be a really good cost containment solution for employers, is offering plans on a voluntary basis. And I think for you all competing against Kootenai County, having the offerings, even if they're on a voluntary basis, is really important to compete when it comes to a benefits basis. And especially if you're paying a lower hourly wage, sometimes competing on a total compensation or a total rewards basis is offering really good benefits, right? And that can be a cost savings for you as well on a holistic basis, because I'm not sure if you guys ever provide your employees with total reward statements. Have you ever heard about what a total reward statement is?
No.
So a total reward statement is something that you put together that's outside of just employee compensation when it comes to wage. You also talk about, here's your medical insurance that I'm offering you and I'm paying this much for it. Here's your retirement package that you're getting and I'm contributing this much additional to it. And that can be a really great differentiator when it comes to a county that can only, maybe be on the lower end of wage, but you're offering really great medical insurance and exemplifying that to employees. That's something that my firm can help you with. And those are the things that we like to differentiate ourselves by just thinking a little bit differently, right? When you're talking to employees about total rewards, total compensation, it's a very different conversation than just wages, right?
which brings up another pain point. One thing I have gotten feedback on from some of our elected and that who supervise, who do exit interviews and things, or hiring. We are, I think, struggling with younger employees in that a trend that I think we're seeing in the area is the desire for higher pay and less benefits.
Yeah.
Because they're younger and they don't value the benefits like older employees do. That's a challenge in our line of work. If you want to recruit and retain younger folks that are going to be with the county a while,
Yep.
and in their mind, benefits aren't nearly as useful as paychecks.
Yeah.
How have you tackled that with people?
Yeah. So that's a trend that's pretty widespread throughout the entire United States, especially with Gen Z, right? They don't really care about anything outside of pay when it comes to traditional benefits. But now we're starting to see things come to the marketplace that offer benefits in a different way. So there's accounts called ICHRAs, ICHRAs. Basically, it's an account that you can fund for those employees to take and use in their healthcare journey however they want. They can pay for a gym membership out of it. They can do things like that. And that's where some of those benefits that are now new to the landscape are starting to be valued by somebody that's younger, because in their mind, that's just more money in their pocket, right? But you're contributing to it on a pre-tax basis. They can contribute to it on a pre-tax basis and draw some additional benefits that they're just being done in a different way. Maybe it's something where you say, hey, if you don't want to have, if you have employer paid disability, maybe we don't do that, or maybe we don't contribute to an HRA, a traditional HRA like you're doing now, and we do it through one of these ICHRAs where you can offer that same dollar but to be used in a completely different way, right? There are also programs like Headspace, which is a bit of a market disruptor when it comes to employee assistance programs, or EAPs. Typically those are, if you're experiencing some type of issue, you're taking care of an elderly person in your family, you've lost a child, you can call in and have kind of mental health visits. You can shift that now to a company like Headspace that does a lot of those same things, but they also offer like the app Headspace that has sleep stories. They have all of these other pieces to it that a lot of younger employees are attracted to more because they're more technological based, right? There are also programs like Garner. Garner is a really interesting way, and I would love to talk to you more about it. You increase your deductible, but what you do is you fund an account through Garner, where if the employees are going to high value providers, that Garner determines are high value providers based off of how often people are coming back. So say you go get a hip surgery. If you're back in 6 months because something went wrong and then another 6 months you're back again, that's not a quality provider, right? A quality provider is somebody that you have a hip surgery, you're never going back again. And they've identified those people that can contain cost, especially for a self-funded health plan like yourself in the GEM plan, and steer people by adding an incentive. Hey, if you go to this provider, we're going to kick you $500. That'll come out of this fund. And what that does is it essentially buys down a deductible that you've raised, but you're encouraging people to go to these high quality providers by giving a financial incentive. You can save on premium. They tout something like 20% cost savings, especially in the first year. So there are these new vehicles that are really designed to push people to quality care. That means they're not coming back time after time and incurring multiple claims if they can go to just one great provider and get it done once. And especially for young people, that can be a really enticing offer because they see that as more money that they're getting just to do a couple of things, right? So just being creative and looking at benefits in a way that you're not traditionally just looking at benefits, accepting the status quo and moving forward by just renewing your plan year over year as is, same benefits. Maybe we're going to bump up a deductible. That's a very old school way of looking at employee benefits. So again, when I'm in here 6 months before your renewal, and those are the things that we'd be talking about. What's latest and greatest to the market? How can we use some of these new point solutions to save costs? And what do you think your employees would find valuable or not? Right. So those are just a couple of ideas when you bring up that question, Dave.
Okay. Okay, that helps.
So can I ask, how do you see, outside of saving costs, how do you see your employee benefits plan evolving over time? Like you mentioned, you're having a hard time attracting younger employees. What other challenges do you have, and have you thought about how you're going to address those challenges?
Well, I mentioned the challenge that, making the employees pay more and more of their deductible at the same time that we're already one of the lower paid entities.
Yeah.
That challenge.
Yeah.
I don't have a solution to that, or I'd be presenting it to the board already.
Certainly, yeah.
Like how are we going to do that? Employees would see that as a pay cut,
Yeah.
rightfully.
Yeah.
More, less money in their pocket, which doesn't make sense if you're giving them a little 2 or 3% COLA, but then you raise their
premiums 5%.
their premium 5%.
Yeah.
It's just a quandary.
Yeah.
The trick is we need our benefit package to encourage people that want to work here because our pay is low. So we need a good benefit package. The balance between those two. How much should we should we focus on benefits, and how much should we focus on, like this pay study that our Mr. Zimmerman has been working on, trying to get us a professional pay study to just figure out really where are we, other than the rumors and what we hear from individual employees, where are we really in relationship to other employers of our size and that we compete with.
Yeah. And those are some areas where we can help as well when you're doing those investigations. So our company, like I mentioned, employee surveys, we do that with a lot of other companies as well. And we can draw on some of those benchmarking studies that we have access to help you in certain areas outside of just employee benefits. So we view ourselves as a holistic business partner that specializes in insurance and employee benefits, right? So how do you feel your current broker is positioned to help you in those challenges outside of benefits?
I would not know.
Yeah. Sounds like maybe they're not positioned to help in those areas.
I don't know what I don't know. I can compare what Tracy did a little bit but I've only had the 2 meetings with the new folks, but I don't have any experience outside of that, other than, 20 or 30 years ago when I did this job.
Yeah.
And it was a whole different,
Yeah.
market and everything else 30 years ago.
I think that's a unique challenge that the county faces, right? Is as new commissioners get elected, it's getting up to speed on the new, latest, and greatest, right? And I would say that I believe it's your broker's responsibility to help you get up to speed. Do you feel like your current broker has helped you get back up to speed on what was done in the past and what's new?
I can't give you an opinion because I have yet to.
I'm still forming mine.
Yeah. Yeah. Well, I think we've had a lot of really good discussion. I think that there are definitely some areas where I can help the county and at least being creative when it comes to your benefits and doing some work on the marketing aspect. So how would you like to proceed from here?
I'm sitting here thinking that normally in our line of work, when we want to consider all the options, we go out to bid for services. I don't know how you go out to bid for broker services.
You can always conduct a broker RFP.
An RSP?
RFP.
An RFP.
Request
for
That one
proposals.
I know.
Certainly.
Yeah.
Yeah. And that's something that, like I mentioned, I would encourage the county to be doing every 3 to 5 years. And when it comes to putting together an RFP process, that's where I would be more than happy to help you in determining what questions you're going to ask of brokers and how to go through that process. I mean, my brokerage firm, I just went through an RFP and submitted a response on Monday. So it's something that we do all the time. And that's where I can be a business partner to you outside of it, and also just provide some, third party direction of like, hey, maybe you should be asking your broker about X, Y, and Z, and have people address certain topics like utilization data. How often am I going to get it? How are you going to be walking me through it? Right.
Okay. Well, that helps to understand the term broker RFP. How long does it typically take to put one together?
It kind of just depends on what all you want to build into it and how many people you want to have actually responding to it, right? I think you could pull one together in a month, a couple of weeks if you have the right resources. And then you typically want to give people 2 weeks to a month to respond. And then what you'll do is you'll go through written responses, determine who your finalists are, and have meetings with all of them on a face-to-face basis.
And would you have any templates or examples that I could look at to consider that?
I can certainly dig some up for you. Yeah.
I for one, would be interested in
Yes.
exploring
Me too.
because we don't know what we are or aren't getting because we haven't had anything to compare it to.
Certainly.
Okay. So that would be one area that I would personally like to hear from you is some examples of RFPs that we might be able to look at to come up with our own
I can certainly do that.
based on that.
Yeah, I can connect with some colleagues and we can draw on some current clients and maybe particularly in the municipality space, see what questions have been asked of brokers in the past. Certainly do that.
Okay.
Yeah, I would appreciate it.
Yeah, of course.
Anything else you can think
Like
of?
I said, I'm new and
You're in that sponge
I am. I'm sorry that I don't really have any response
Yeah.
because there's not much that I can speak to yet. And I do wish our HR was here because that would have helped with some of the questions.
That was
She
an
would have
oversight
been-
on our part. We should have had her here.
Yeah.
That's okay.
She.
Like I said, I'm back every couple of months, so I'm
Yeah.
happy to come back in and
Yeah.
sit back down for another
Yeah.
conversation.
Yeah. And
Yeah.
I think it would be good for you to meet her and
Yeah.
and get some of that information that you've asked that
Yeah.
we.
I think it would be handy to pursue the idea of this RFP a little bit further if you're willing.
Yeah, certainly. More than
Okay.
happy to do that and,
Yeah.
and show you my value and how I believe I have a really unique perspective when it comes to the county. I'm very familiar with the challenges that you guys face because I'm ingrained with the community, right? Through the Memorial Fund, I'm having conversations with the sheriff's office. I'm having conversations with the prosecutor's office and magistrate's office, all of those different areas, right? So I'm happy to exemplify that and put my best work up against somebody else and win your business.
Okay.
All right.
Public question or comment?
No.
Okay. Anything else you'd like to share?
I think that's it. Just again, want to say thank you so much for the time. It's really awesome for me to be sitting on this side of the table with the prospect of working with the county. Something I've always kind of like wanted to get to in my career, and I just appreciate the opportunity.
And I was going to ask you for a card, but it looks like your contact
Information's on the back. I actually do have a couple of business cards. Make it easy for you.
That would be nice.
Of course.
I do not have my cards in yet, but I will soon.
Gotta keep them in a bag so they don't get messed up too bad.
Thank you.
Yeah, of course.
Thank you.
Thank you.
Matt, would you like one?
No.
You sure?
Jordan knows how to get hold of you.
Yes, he certainly does. Yeah. Well, again, thank you guys so much for the time. I really appreciate it. And I'll circle back maybe in about a week. I'll connect with some of my colleagues and try and figure out some resources that we might be able to send your way when it comes to a broker RFP. And I'll try and get back to you by maybe end of next week.
Yeah, if you could send me some concepts and ideas that we might use as we develop something of our own, that would be better than starting with nothing. Why reinvent that wheel?
Exactly.
Okay.
Like I said, I'm here along the way. If you have any questions, you have my contact information once I share that info with you, and I'm more than happy to just have an open discussion.
Mm-hmm. Well, thank you for taking the time.
Thank you.
Thank you so much for having me. I appreciate it.
We're
Yeah.
adjourned.